Chronic obstructive pulmonary disease, COPD, is a progressive lung disease characterized by persistent respiratory symptoms and airflow limitation due to airway and/or alveolar abnormalities. It is commonly associated with significant morbidity and mortality and is primarily caused by long-term exposure to harmful substances, particularly cigarette smoke. Key ailments constituting COPD. 1. Chronic bronchitis, defined by a chronic cough and the production of sputum, mucus, for at least 3 months over 2 consecutive years. It involves inflammation of the bronchial tubes, leading to increased mucus production and narrowing of the airways, which makes breathing difficult. 2. Emphysema, characterized by the destruction of the alveoli, air sacs, in the lungs, leading to reduced surface area for gas exchange. This condition results in difficulty exhaling air, trapping it in the lungs and causing shortness of breath. 3. Other conditions. Although chronic bronchitis and emphysema are the primary components of COPD, other respiratory conditions may also contribute to the overall COPD diagnosis, such as asthma, in some cases, particularly if it leads to significant airflow limitation, bronchiectasis, abnormal widening of the bronchi or their branches. Symptoms of COPD: shortness of breath, especially during physical activities, chronic cough, often with sputum production, wheezing, chest tightness, frequent respiratory infections. Risk factors: smoking, the primary risk factor, exposure to secondhand smoke, long-term exposure to air pollutants such as dust, fumes, and chemicals, genetic factors, e.g. alpha-1 antitrypsin deficiency. Management. COPD is a chronic condition that requires ongoing management, including smoking cessation, bronchodilator medications, inhaled corticosteroids, pulmonary rehabilitation, and in severe cases, oxygen therapy or surgery. In summary, COPD is a serious lung disease primarily composed of chronic bronchitis and emphysema, leading to airflow limitation and breathing difficulties.